Hi everyone and welcome back to my channel. Today we're going to be talking about your body after childbirth. Now, some of you or most of you who are parents would know that your body changes after you've given birth to your baby. Some people find it very difficult to get over things like that, looking at your body in the mirror and it's different to what you had before. So I'm just here to just go through certain things that can happen to your body during childbirth and after you've had a child, and how to kind of manage, treat it, and also to slowly, realize the word I've just used, slowly progress to getting your body back. It's not going to be exactly how it was, but you can have a healthy new you. Okay, so stitches. When you have a baby, you have stitches. Okay, so if you've had stitches after, let's say, tearing up, or what we call the episiotomy cut. Episiotomy cut is where, if you're having a natural delivery, they use a scissors to cut the opening of the vagina. If it's too tight for the baby's head to come out, they open it slightly just so that the head can come out so you don't tear. But times you do tear when you're pushing the baby through, because it's a very small area for a huge head to come through. So sometimes you do tear, and when you tear like that, obviously they do stitches, whether it's cut manually or it tears. You do get stitches up there, which you have to treat. Okay, you have to bath every day in salt water to heal it. So down there, let me be very honest with you, down there hardly sees any air. Okay, so if you're at home, you need to make sure you are letting air go in that area. You have to bath in a warm salty water, and make sure, it's usually Epsom salt that they use. Make sure that you're soaking and washing it regularly. Make sure there's no, well, basically to prevent any bacteria, germs going in there. And make sure it sees air quite often as well. If the stitches are still sore and uncomfortable, you need to let the midwife know about that so they look into it. If it's really painful, usually the first few days is usually painful, make sure you take painkillers as well. Painkillers, usually they're your besties. Like if you're struggling through those kind of pains, use painkillers. But if you breastfeed as well, you need to check with the pharmacist and also with the doctor that prescribes that medication for you, to not have a higher dose, which will affect your breast milk, because obviously the breast milk is being given to the baby and you don't want a high dosage of painkiller or any kind of medication affecting or going through to the baby. Stitches also dissolve when the cut is healed. You don't have to go and remove the stitches. It dissolves naturally when the cut is healed. But there are times when the stitches has to be taken out, especially with the C-section, like cesarean, when the stomach is cut to let the baby out. Sometimes the stitches have to be manually taken out, so you need to go to the hospital for that to happen. Number 2, going to the toilet is also a very difficult thing after having a baby. It can actually be quite frightening because you're scared of weeing, especially if you have stitches as well. Scared of weeing, urinating in case it stings, because sometimes it does sting when it gets into the soreness of the area. It does sting. What I would say is that drink a lot of water, because that can dilute urination a bit before you obviously urinate. So drink lots of water, which will make it sting less when it comes out. Reach out to your midwife if you're struggling. Any struggles that you're having as a new mom, make sure you let the midwife know, or the health visitor know as well. You probably want to have a poo for a few days. You probably, if I remember correctly, you probably would not want to have poo the next few days because you're so scared of the soreness. Or sometimes you get constipated after having a baby, but what you need to remember is try and not make sure that you're constipated. Try and eat things that will make your stools soft to be able to come out, because if you're constipated and you're pushing while you have the sore, it can burst the stitches open. It can be even more painful. So just make sure you don't get constipated. Make sure you eat your fruits, your veg, your salad, your whole meal kind of foods as well, as they also help. Another thing you have is your bladder control. So bladder control after having a baby, it's common to leak a bit of wee. After having a baby, you do leak a bit of urination. If you laugh, if you cough, or even if you sneeze, suddenly there's a trickle of, coming down below. So just make sure you do your pelvic floor exercises, which helps with that. What you do is pelvic floor exercise is when you squeeze in. I'm doing it right now, but you can't tell. So you squeeze in your uterus, like you're down there, like you squeezing it to prevent you from having a wee. That's the only way I can describe it. So to prevent you from urinating, that kind of feeling where you hold it. That's what the exercise is. So you hold, you stop. A few seconds, you hold, you stop. And that's supposed to strengthen your pelvic floor so that it's not loose. It tightens back up to pre-baby. Yeah, pre-baby. Piles is another thing that I want us to talk about. Piles or hemorrhoids are also common and disappears in a few days or few weeks. You need to eat a lot of fruits and vegetables. Try not to push or strain, as it will make piles worse. So it's like the piles sometimes gather when near your anus area, when you're having constipated poos, pushing so hard, and it's not coming, you keep pushing and you're straining, it causes piles. Speak to your GP or midwife if you're having struggles with releasing some stools. Sometimes they give you creams and stuff like that to use to ease that. The other thing is bleeding after birth, which is called lochia. So you will bleed, obviously, from your vagina after birth. It will be heavy at first, and then you will need like a kind of a super absorbent pad to use for a few days, because once you give birth, the blood will still keep coming. It's like it's pouring a lot, and you need to change that often as well. Change it regularly, wash your hands regularly as well, and make sure that area is catered for and looked after very well. I wouldn't recommend you to use tampons. I don't agree with tampons anyway. Even before baby or whatever, I wouldn't recommend that until at least 6 weeks after postnatal check. Or this could increase your chance of infection. For me, tampons, I don't know, putting it up there, I feel like it's pushing your blood up. I prefer the natural way for it to come out naturally onto the pad. So yeah, that's something to think about. You will notice the blood is redder, and then eventually it tends to like a kind of like a brownish color, and then eventually it goes. The blood becomes redder when you are breastfeeding more, and it becomes heavier as well when you're breastfeeding more. So that's nothing to worry about. So what I can say is that when you are breastfeeding, sometimes you feel contractions or pain, sharp pains in your stomach when you're breastfeeding. And once that happens, your blood also becomes heavier as well. And then you'll be feeling the cramps, which is similar to your period pain. It's normal. After birth as well, you get more cramps as you breastfeed. All that is normal. The bleeding will continue for a few weeks, like I said, and then decrease and then stop. So if you're losing more blood and having clots in the blood as well, make sure you contact your general practitioner or health medical health visitor, health nurse as well. Okay, I hope that helps. If I'm missing anything, guys, don't be shy, let me know. And as always, guys, have a good week, and I'll see you next week. Ciao.